the Dermatology Associates and Surgery Center.
Welcome back. We are here in the studios with Dr. Velazquez from Dermatology Associates and Surgery Center. Dr. Velazquez, nice to have you with us.
Thank you.
The last time you were here, we talked about the various forms of skin cancer. What do you and your team do when there is a concern that possibly a mole or a lesion has become cancerous? What is the process in determining if it is?
Yeah, so if we as providers suspect a problem or an issue to try to make a diagnosis either for a rash or for our suspicious lesions, we many times then will do a skin biopsy for this lesion. And the way that a skin biopsy will be done, they could be done in a couple of different ways. We can do what we call a punch biopsy, which means we take an instrument and do like a core of skin that gets removed, and we usually put a suture on that. Or we can take what we call a shave biopsy. We just kind of numb the area, whelp the skin, and take a little slice of superficial skin. So that tissue will be sent to pathologists so they can process that skin, and the pathologist will then render a diagnosis for this lesion. So depending on what the diagnosis comes, and let's just say that the diagnosis comes back as a skin cancer, then the provider will discuss different treatment options. The one treatment for basal cell squamous cell carcinoma mainly that is the best and most effective way to remove a skin cancer is through a procedure. It's called a Mohs procedure. In a Mohs procedure, what happens is we take a skin cancer and we excise the lesion at the clinical side, the smallest amount that we see. We then process that skin and we analyze that skin and make sure that the skin is completely clear skin cancer, which is the most effective way to treat the skin cancer.
I see. Okay. And then once you make that determination, what is the typical process? Is it chemotherapy, radiation?
Well, normally after we excise it and we have clear margins, the majority of the cases, patients get the skin cancer has been eradicated and we just close the skin lesion.
I see.
So it will be done for sure in basal cells and mostly squamous cells. Radiation treatment and that sort of a thing happens sometimes, but these are for much larger lesions, normally speaking.
I see. And with any type of skin cancer, early detection is the best prevention.
Oh, absolutely. As a skin lesion is changing, whether it's bleeding or painful, these are signs for you to go ahead and have this lesion evaluated, and so it can be properly taken care of.
And you have 3 locations in West Virginia, is that correct, if someone would need to see you?
No, we have actually more locations for this area. We have the 3 locations in Charleston, Hurricane, and Logan.
Okay, very good. Well, Dr. Velazquez, great information as always. Viewers, thank you so much. We'll be right back.